My name is John Henry Pang. My pronouns are he, him, and I identify as a gay cisgender man. I'm a plastic and reconstructive surgeon here at Mount Sinai, an assistant professor of surgery at the Icahn School of Medicine. And my full-time practice is transgender surgery as part of Mount Sinai Center for Transgender Medicine and Surgery. So while our current practice, providing surgical care for our transgender and gender non-binary patients is paused due to the COVID outbreak, I've been supporting our teams at Mount Sinai Queens Hospital and Mount Sinai Beth Israel. The call for help was to provide support in any position. So that means all of our medical staff, including surgeons, medical assistants, physician assistants, and nurses being asked to do things that are not normally part of our usual jobs. So we've been transporting patients, hand ventilating them, assisting with codes and medical emergencies, placing invasive IV access lines so patients can get IV fluids or receive dialysis, calling families, admitting emergency room patients, basically interfacing with our medical teams in any way that they need support. And so every day has been a new experience and a different experience. And between these shifts, I've been trying to see my transgender and non-binary patients through telehealth visits to check in on them, make sure they're doing okay. So we're staying busy and helping where we can. During this period, a lot of people have described this disease as a great equalizer because anyone can be infected or affected by it. And what's interesting is my usual day-to-day work is dedicated to caring for transgender and non-binary patients, within our LGBTQ community, a community that's been historically and continues to be marginalized and underserved, with disproportionately higher rates of homelessness, assault, disease, crime, especially against people of color within our community. Interestingly, you see the same thing with this virus. The worst hit communities are those that are less advantaged. It's a sobering reminder that the virus has not actually been an equalizer. It's in fact exposed the inequality that exists in access to healthcare. And so we have, it reminds us that we have work to do to fix that. These have been surreal, strange, and for a lot of us, heartbreaking times. I've had some pretty difficult conversations with families. I've seen families having to say goodbye through video chat. Through these times, though, the silver lining, if you can describe it that way, has been seeing the resilience and the strength of families and of our healthcare teams. Everyone I talk to says how grateful families and loved ones have been, even as they grieve. They understand all the hard work involved from our healthcare workers. And I'm there to lend a hand, but there are members of our staff, doctors, nurses, assistants, residents working far longer hours than I have. And they continue to show up, which is something that I found very inspiring. And I've met some of the most amazing people while doing this. A CRNA from Virginia, a trauma critical care surgeon from Minneapolis, who I've befriended, people from all over who answered a need and called for help that I've been touched and inspired by. The thing is that they all have families of their own, and yet they still showed up for ours. So I hope going forward that we continue to remember these lessons. We still have some work to do, but moments like this really offer us the opportunity to see the best parts of people and see what we're capable of. So let's continue to bring those moments out. Please stay safe and see you all soon. Bye.